Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Heart attack. Introduction. Each year, millions of people worldwide have a heart attack. Most heart attacks happen when a clot in the coronary artery blocks the supply of blood and oxygen to the heart. A blockage that is not treated within a few hours can cause permanent damage to the affected heart muscle. Thanks to medical technology, most heart attacks can be successfully treated if medical help is provided right away. This program will help you understand the signs and causes of heart attacks in case you or a loved one is at risk. It will also help you prepare for such an emergency. Tips for preventing heart attacks will also be presented. Symptoms. Most patients feel severe chest pain or pressure during a heart attack. This pain can spread to the arms, neck, back, and jaw area. The pain may be prolonged, lasting anywhere from 30 minutes to several hours. If resting or changing your position does not stop the pain or provide much relief, you may be having a heart attack. Some people feel indigestion and nausea during a heart attack. This may be coupled with sweating, dizziness, or shortness of breath. Some people do not feel any chest pain during a heart attack. This is especially true of people with diabetes and people over the age of 75. Heart anatomy. The heart is responsible for pumping blood to all the organs in the body. It is a specialized muscle that is expected to work continuously without rest for a lifetime. The heart has a right and a left side. Each side has two chambers, an atrium and a ventricle. Valves divide the chambers and prevent blood from flowing backward. Blood loaded with oxygen comes from the lungs and enters the left atrium. It stays there until the mitral valve opens up and the atrium contracts. The contracting atrium forces blood into the left ventricle. The blood is then pumped to the rest of the body through the aortic valve into the biggest blood vessel of the body, the aorta. After the blood comes back from traveling through the body, it goes into the right atrium. From there it is pumped into the right ventricle through the tricuspid valve and then to the lungs through the pulmonic valve. In the lungs, the blood picks up oxygen and returns to the left atrium where the whole cycle starts again. The heart needs a continuous supply of oxygen and other nutrients like sugar to be able to function. Oxygen-rich blood is delivered to the heart through the coronary arteries. These arteries branch off from the aorta. The heart contracts by itself at the same time on both sides. Cells in the right atrium set off the electric current needed to cause both atria to contract. The electric current spreads to the ventricles through specialized cells. This causes the ventricles to contract after the atria do. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Fatty material, called plaque, can narrow the blood vessels of the heart. This is called atherosclerosis. Coronary artery disease develops if the blood vessels that carry oxygen to the heart become clogged. Atherosclerosis can cause decreased blood flow and oxygen to the heart muscle. This is called ischemia. The first sign of coronary artery disease may be chest pain called angina. Unlike a heart attack, angina disappears after about 5 minutes of rest or after taking special medications. A coronary artery can become completely blocked by plaque or by a thrombus. A thrombus, or blood clot, happens when blood clots in an artery and totally blocks it. This usually happens in arteries that are already damaged and narrowed by plaque. When a thrombus forms in a blood vessel, it is called thrombosis. This causes blood flow to that part of the heart to stop. Without blood, the cells of the affected heart muscle will become permanently damaged. This is what happens during a heart attack. Angina versus heart attack. The signs of a heart attack are similar to those of angina with three main differences. With a heart attack, 1. The pain is more severe. 2. The pain usually lasts longer than 5 minutes. 3. Nitroglycerin or rest does not relieve the pain. As the coronary arteries get blocked, angina develops. If committing to a healthier lifestyle does not control coronary artery disease, the blockage will get worse. Eventually, some of the coronary arteries may become completely blocked and cause a heart attack. If you feel chest pain during physical activity and the pain stops when you rest, you probably have angina. You should check with your healthcare provider about the pain as soon as possible. If you have medication for angina, and neither resting nor taking the medication relieves the pain, you could be having a heart attack and you should call for help right away. Treatment. During angina, the heart does not receive enough oxygen. During a heart attack, the oxygen supply to part of the heart is completely blocked. The heart muscle starts to die by the minute. Within 6 hours, the heart has been greatly damaged. If medical treatment is performed within the first hour after a heart attack, the damage may be limited and the person is more likely to survive. At the hospital, your healthcare provider will do an electrocardiogram, or EKG, to help confirm whether you are having a heart attack. Blood tests are also done to check for heart muscle damage. Treatment is usually started before the results of the blood tests are back from the lab. If a heart attack is confirmed, your healthcare provider can 1. Give you medications to dissolve blood clots and open the arteries. These are known as thrombolytic drugs or clot busters. Most of these medications are effective within 1 hour of the start of the heart attack. This is why it is important to get to the hospital within an hour of the start of chest pain or other symptoms. Your healthcare provider can also 2. Give you medication to relieve your pain. 3. Stabilize your heart rhythm. 4. Help you breathe better. Cardiac catheterization may be done to look at the blood vessels of the heart. Depending on what cardiac catheterization shows during this procedure, the cardiologist may be able to open the clogged or narrowed arteries with balloons and metallic mesh, known as stents, during cardiac catheterization. If cardiac angiography is not successful, or if the cardiologist decides that he or she cannot open the clogged artery with balloons or stents, open heart surgery may be recommended. During open heart surgery, the clogged arteries are bypassed with leg veins or chest arteries. If treated early, the heart will heal itself of any minor damage caused by a heart attack. If an effort is made to live a healthier lifestyle, future heart attacks can be prevented. If you think you are having a heart attack, get medical attention as quickly as possible. It is best to have a plan ready in case it happens. Your emergency plan. In case you feel signs of a heart attack, you need to know who you are going to tell, how long you will wait before you seek medical care. You will also need to know which medical facility you will go to and how you will get there, what information you will need to provide to your healthcare provider. In case you are alone when the signs of a heart attack start, decide now who you will call and have his or her phone number on hand. This might be a friend or your healthcare provider. It is a good idea to share your health condition with a friend, spouse, roommate, or healthcare provider. This could help to ensure that you get help when needed. Decide when you should seek medical help. If you have already seen a healthcare provider for angina, your healthcare provider will tell you when to call for help. You should not wait more than 5 minutes before calling 911. This is especially true if the symptoms are severe and different from any milder angina pain you may have had in the past. As you rest, loosen any tight clothing and sit or lie in a comfortable position. Open a window if that would help you relax. Decide how you are going to seek medical help. Which hospital emergency room will you go to? Most healthcare facilities are able to stabilize a patient with a heart attack. It is always better to call 911. In rare cases, some people who are close to a healthcare facility may be able to get there faster. The ambulance crew who will come to pick you up has specialized machines that can save your life if you suffer a sudden total cardiac arrest, which means that your heart has stopped beating. If your condition is life-threatening and a person with you knows CPR, that person should call 911 for an ambulance and initiate CPR. If you have already been prescribed medication, follow your healthcare provider's instructions. In case you are taking nitroglycerin, this usually means calling for help if the pain lasts longer than 5 minutes and one dose of nitroglycerin does not relieve it. Do not wait for 5 minutes if the pain is of a different type and intensity than angina. Call 911 immediately. Know what information you should provide at the hospital. Be prepared to tell the emergency room healthcare provider what type of pain you are feeling, when it started, if the pain changed since it started, what medications you have taken for the pain. You should also tell your emergency healthcare team if you have had a heart attack before, if you have had angina before, what medications you take on a regular basis. When you arrive at the emergency room, make sure you say, "I think I'm having a heart attack." If you don't and they have other emergencies, you may not get attention right away. Some people are afraid of being embarrassed if they say they are having a heart attack and it turns out that they are not. Others convince themselves that their heart attack is indigestion or a sore muscle. Some people who do not seek treatment on time die. Cardiac arrest. A heart attack may cause cardiac arrest. Cardiac arrest happens when the heart stops pumping blood to organs of the body. 10 seconds into cardiac arrest, a person loses consciousness. If you shake or shout at the person, he or she will not respond. As the heart stops, breathing may stop completely. When this happens, the person is having cardiopulmonary arrest. Without cardiopulmonary resuscitation, or CPR, the patient may die. Not all heart attacks lead to cardiac arrest, but when it happens, the person or people you have chosen to share your health condition with should call 911, then immediately perform CPR. Some patients faint during a heart attack, but their heart keeps beating. This is not cardiac arrest. To determine if a person is having cardiac arrest and needs CPR, you check his or her pulse. If you cannot check the person's pulse, perform CPR without checking the pulse. The last few years have seen an increase in the availability of special machines that can shock the heart in cases of cardiac arrest. These are known as automated external defibrillators, or AEDs. These life-saving devices can now be found in many public places and airplanes. If an AED is available, it should be used before CPR is initiated or 911 called. These machines are easy to use. You, your family members, and your friends should learn how to use these machines. Ask your local hospital about special classes that teach the use of AEDs. Prevention. Medications, procedures, and surgeries do not cure coronary artery disease. If healthy lifestyle changes are not adopted, blockage of coronary arteries will become even worse until a heart attack happens. The following are 9 important tips for living a healthier lifestyle that can improve the health of your heart. 1. Do not smoke. People who smoke are 3 times more likely to die from heart disease than non-smokers. 2. Be physically active under your healthcare provider's supervision. 3. Eat a healthy, balanced diet that contains a lot of vegetables and is high in fiber. Avoid fried food and other food that contains trans fat. Limit processed packaged food and food that contains sugar. 4. Check the level of cholesterol in your blood. If it is high, get it under control. 5. Check your blood pressure regularly. If it is high, keep it under control. 6. Lose weight if you are overweight. 7. Check the level of sugar in your blood. If it is high, keep it under control. 8. Get enough sleep at night. 9. Manage stress in your life. If you have angina or other heart diseases, talk with your healthcare provider before starting any exercise or weight loss program. In addition to lifestyle changes, the right combination of medications can lower your risk of heart attack. Your healthcare provider may prescribe medications that help lower blood pressure, reduce the chance of blood clots forming, or manage your cholesterol. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Each year, millions of people worldwide have a heart attack. A blockage that is not treated within a few hours can cause permanent damage to the affected heart muscle. Most patients feel severe chest pain or pressure during a heart attack. If resting or changing your position does not stop the pain or provide much relief, you may be having a heart attack. Some people do not feel any chest pain during a heart attack. Coronary artery disease develops if the blood vessels that carry oxygen to the heart become clogged. This is called atherosclerosis. The first sign of coronary artery disease may be chest pain called angina. The signs of a heart attack are similar to those of angina with three main differences. With a heart attack, 1. The pain is more severe. 2. The pain usually lasts longer than 5 minutes. 3. Nitroglycerin or rest does not relieve the pain. If a heart attack is confirmed, your healthcare provider can give you medications to dissolve blood clots and open the arteries. It is important to get to the hospital within an hour of the start of chest pain or other symptoms. You should not wait more than 5 minutes before calling 911. A heart attack may cause cardiac arrest. Cardiac arrest happens when the heart stops pumping blood to organs of the body. If you have coronary artery disease, your chance of surviving a heart attack is much higher if you have a plan of action. This plan involves determining who to alert, when to seek emergency medical help, how to get there, and what to tell the emergency healthcare providers. To prevent future heart attacks, do not smoke. Exercise regularly under your healthcare provider's supervision. Eat right. Control your cholesterol, blood pressure, and blood sugar levels. Get enough sleep at night. Thank you for using Explain.